So, welcome everyone to I can't remember which part of the series this is, but it's the one about vascular surgery. We've had a couple of these now, and they seem to have been going quite well. So it's whistle stop tour, ultimate guide to starting F1 in vascular surgery. We're really lucky to have Jazz with us today, who was an F1 in vascular surgery at QMC. A bit more about her. Here's the next slide for me, Jazz. So currently in F1, but apparently it was one of your last days today, wasn't it?
Yeah.
So almost there with that F2. She graduated from Malaysia in 2024 and has completed the MRCS. And as you can see, has done pediatrics, vascular surgery, and is just finishing off with geriatrics. So we're really lucky to have her wisdom. So a bit more about Medics&Me. So we're a nationwide charity. We aim to support aspiring medics, current medical students, and people who have graduated as well, so resident doctors, building community and just kind of widening access to medicine as a career. So we've got plenty of teaching opportunities. There's opportunities to get involved with QI and research, which as an F1 and F2 are part of what you need to be able to kind of graduate F1 and F2. So getting experience within those is really helpful. We run a careers blog as well, where you can get some advice about what you want to do, how you can do that, and who to get in contact with. And if you're interested, we really appreciate anyone coming and being a mentor. So going into schools and helping aspiring medics kind of get into medicine. So if that's something you're interested in, please feel free to check out our website or any of our social medias, which I assume you have, seeing as you've seen the advertising for the event. So on that note, off you go, Jazz.
Okay. Hi, everyone. My name is Jasmine. I've done vascular surgery rotation 4 months ago. So I was actually in general surgery, but I got put in vascular wards. So it's a nice little community, nice little team in vascular. You'll work very closely with the consultants, registrars, and the SHOs and your F1 colleagues, which is really nice because you'll sort of have like a continuity of care. So you'll know the patients, you'll see them come in again next month or whenever. But it's really nice working in vascular. So anyway, today we will cover what to expect as an F1 in the placement. Little bit about clerking, some common pathologies and emergencies that you cannot miss and must recognize working in vascular, and how a typical week looks like for an F1, some diagnostic procedures, and just basically how to build your portfolio and manage your own well-being. So expectations of an F1 on the job. So you'll obviously have daily ward responsibilities. Ward round prepping is very important in the morning. So you'll come in at 8. It's nice if you can come in a bit maybe like 5 minutes early, or depending on how you like to do your job. So you'll come in, you'll prep the notes, you'll just have a look at everything that's been going on overnight, receive handovers from the night team, if any. You'll be in the handover room. You'll just have sort of like a mini handover from the night team. You'll discuss patients, and then you'll go see all the patients with the consultant, the registrar, and your colleagues. So during for ward round preparation, we'll go through it, like what you have to write in the notes, basically. And then you'll also have responsibilities like documenting management plans, requesting investigations like duplexes and angiograms in vascular. Prescribing medications like heparin and warfarin, IV fluids, and then complete discharge summaries and TTOs. You'll learn what to write in the TTOs as you go along, and if it's going to be your first job, you learn how to do it, and then you'll take a long time doing it for the first time, and then you'll sort of like get the rhythm, and you'll be very quick at the end of the rotation, so don't worry too much about it. You'll have to speak with patients and families and coordinate referrals as well. So communication skills, you would build them in this rotation. And then patient management, assessing unwell patients, A, B, C, D, E, and just it's very important to know when to escalate and like it's important to escalate early in vascular. In vascular, you will have the ward registrar, and you will have the on-call registrar. So you'll always have a senior to escalate something to. And then you'll manage post-op patients. There's going to be a lot of procedures that you can do. Blood taking, cannulas, ABGs, urinary catheters, and also you'll be able to get chances to go down to theatres to get more exposure and to build your portfolio, especially if you want to do surgery, and even more if you want to do vascular surgery. Just make sure you try to find some time to go down to theatres. You'll learn a lot. So this is just an example of what the enoxaparin prescribed. This is like BTE prophylaxis. I'm sorry, I just put this in too early. But yeah, you'll learn how to prescribe warfarin. I've looked for like the yellow chart that's like a yellow chart that we use in QMC, but I couldn't find it online. So you learn it. But basically everything is on Koha, on the intranet, these guidelines, but this is how it looks like. I just love having it starred in my phone, just so whenever I have to just quickly check the dosing, I can simply just open my phone and do it really quickly. So yeah, warfarin and enoxaparin, you learn when to give it, because I will say vascular is very senior led as well, so you'll sort of learn which patients need to be on enoxaparin and which patients have to be on warfarin. Okay. And then this is something that you'll see in the doctor's office. So it's just the standard antiplatelet guidance for vascular patients. So let's say the patient let's take the second example. So for a patient who's had angioplasty, plus minus a stent, after the procedure, they'll usually be on 75 milligrams of aspirin and 75 milligrams of clopidogrel. So you'll just have to know this sort of thing and discharge them with these medications. So there's a lot of pathologies and procedures that are done and which would need antiplatelet and anticoagulation afterwards. So just be aware of that. This is an example of a duplex report. So during ward round, consultants will ask, has this patient had a duplex? And if so, can I see it? So sometimes they print it out and they write stuff down, but sometimes it's not in the folders. So you would have to open another system we call Notice. You'll have access your logins to it. But yeah, Notice is also where you can find most of the past procedures or investigations, anything. It's basically everything's on DHR and Notice. So yeah, and you learn how to interpret them as well. So as you can see this one, you can see a bypass graft, and you learn how to present a duplex report as well, which is very fun to learn. It's good once you get the hang of it. And then for clerking, I'm sure all of you know how to clerk, what to ask, and just to point out in vascular, it's important to ask like about their pain, go into detail, and then just assess, just ask about their claudication, how far is it from, when you go to the bathroom, and like how many meters approximately, like 100 meters, 200 meters, and then do they have any rest pain, like at night when they sleep, do they hang their foot by the bedside, and obviously vascular history, had any angioplasties done, any operations done, also risk factors and functional status. Don't forget your drug history. Okay, and then these are the common pathologies. I'm not going to go deep into it because I feel like this is more of a sharing session instead of teaching session. Just know these are the common ones that you'll see every day in the ward. And it's good to know what you're treating. Yeah. But yeah, just to point out for acute limb ischemia, so that is an emergency, so never miss that. I'll have another slide going into it. Yeah. And then, so must not miss emergency. So this is it. Acute limb ischemia. So you obviously know the 6Ps: pain, pulseless, paralysis, pallor, paresthesia, and perishing cold. I have seen one in the ward throughout my 4 months. So it could be, you could encounter it like a lot, but I didn't. So but yeah, it is, you cannot miss, make sure not to miss it, and make sure you escalate early to the registrar. So you'll have once you start working, I think you'll have an induction on the first day, and then you will be given the ward registrar and the on-call registrar's phone number. So also make sure you have that starred in your phone just in case anything happens. So yeah, obviously in initial management, ABCDE, escalate using SBAR, make sure you put 2 cannulas in, take some bloods, do a VBG, assess if the patient needs IV fluids, keep the patient nil by mouth, just in case they need to go down to theatres, and then immediate senior review. So other emergencies include like a ruptured AAA. This is also time critical, escalate immediately. For sepsis, you would encounter this a lot overnight as well if you do twilights. So don't forget sepsis 6, and then compartment syndrome, and some post-op bleeding. So sometimes patients come in for angioplasty, and then once they've had it done, so angioplasties, you go in through the groin, so they can have groin hematoma. It can be a huge hematoma. So number 1 is apply pressure, and then number 2, just escalate immediately. Just get the registrar on the phone to review. And then, so a week in the life of an F1. So as I mentioned, at 8 a.m. you'll start board round. So basically, it's board round will be, I think, just in the handover room, and then you'll start the proper ward round with the consultants. You would use, I feel like it's beneficial to use the cow. So that's the computer on wheels. It's very nice to have it. So someone managing the cow, and then one person writes stuff down. I feel like that can help ease the whole ward round. And then after the ward round, you organize jobs, update nerve center, and then you'll do discharge summaries throughout the day. There can be so many discharge summaries. So make sure you don't forget to email the follow-ups, the email follow-up appointments, just to arrange them, because you don't actually arrange them, you just send emails, and then the vascular admin team will arrange. But I think these follow-ups usually get missed. I mean, not usually, like sometimes they get missed because there's just too many and you sort of forget them. So don't forget. And then you'll have handovers at about 4, because you'll have the twilight doctor coming in at 4, but you actually leave at 5. So make sure you hand over things, and then your twilight shift, it starts at 4 p.m. and it ends about 11:30. You go to handover because you actually finish at 12. So don't forget to grab your device from Hospital 24. You'll get tasked throughout the night. If you do need any help, there'll be an SHO around, so make sure you just know who to call. Yeah. And then during the weekends, it can get a little bit overwhelming, because during the weekends, it's just one F1 and then one registrar and the consultant. But you'll learn how to manage. Just know which patients to prioritize your jobs during the weekend, because obviously a lot of things can't be done during the weekend. So yeah, if you do need any help, there'll be a registrar and a consultant. Okay. And then this is how when during ward round, what you'll write is basically just don't forget the date and the time, and then just write ward round, let's say Mr. Bachelder, and then consultant, and then write your name as well, age, diagnosis, and all the common things. I think you already know this. I know you guys have had rotations in so many departments, and we use literally the same thing. So any bloods, if the patient has any drains in, don't forget to note like how many mils in the drain, and then wound review, any bleeding, infection, stump reviews, and then the plan. So I'm going to move this. Okay, so if you use the cow, it's nice to just get nerve center notice ready, and then you can create a jobs list as well, on a book or a piece of paper on your own. We usually just have a book in the vascular ward where we all put down the jobs. So everyone uses that book. So whenever you do stuff, then you just cross it off. And then so nothing gets missed. Because if you have your own sort of list, then things can get jumbled up and you miss things. You don't want that. And then you can also do certain jobs during the ward round, like requesting investigations, bloods, prescribing medications, stopping them. Yeah. So a lot of things can be done during ward round so that you have less jobs during the day. Okay. And then for diagnostics and investigations, you will be ordering lots of toe pressures, duplex. And how to do this is there's literally a vascular lab beside E16, the vascular ward in QMC. You'll basically just go to the vascular lab and say, I need an right arterial duplex for this patient, so and so. So you'll give the patient's details, what you need, so duplex or toe pressure or anything, and then sometimes they want you to give a whole story as well, like what is the patient info, on examination, what did you find, and then only they'll approve the request. So make sure you have a clear clinical question and findings as well. So if you're unsure, just ask. And then you also order a bunch of things, angiograms, angiographies. That one you can usually ask your registrar how to do it, because I'm not going to teach you because I don't have like nerve center on and stuff. But yeah, you learn to request a lot of vascular procedures. So this is an example of an angiogram. The registrars are really good at teaching. They love teaching. Just ask. They will definitely teach you. So we went through lots of angiograms of patients, and what they like to ask is like, how do you know where you are? So the first thing you see is the bones. So you can sort of see in this first picture, the E picture, you can see like the femur, the tibia, the fibula. So you can sort of know which artery that is. So know your anatomy as well. But I mean, they're very open to questions. There's no stupid questions, just ask. But yeah, it's really interesting. You can see where there's like what do you call that? Like, I'm losing my words here. Constrictions or stenosis or blockages or stents. You can definitely see all of that in an angiogram. Yeah, and then for common conditions and ward procedures, the common conditions I've mentioned earlier. So for routine post-op care, so you'll do monitoring bloods, you'll check whether they're on any anticoagulation, prescribe statins, antiplatelets, you'll monitor wounds, check pulses every day. And then for post-angioplasty patients, you'll monitor the puncture site, like I mentioned, the groin. So you'll have to make sure that there's no groin hematoma. You'll check for distal pulses. Basically the same thing. And for post-EVAR, so EVAR is endovascular aneurysm repair. These are the two things that you would have to do. So number one would be, three things that you have to do. So abdominal X-ray and duplex ultrasound on day one post-op. And then you'll have a CT surveillance at 3 months. So these things you'll have to know so that you don't miss it. And then you'll have a There's patients with carotid endarterectomy as well. Just monitor for stroke symptoms as well. So patients will have like a huge scar here. And during ward rounds, we'll check whether the patients you ask them to stick out their tongue and see if there's any nerve damage as well. And then for amputation patients, they'll have physio, OT, and wound checks are usually on day 5. So you won't touch the stump until it's day 5. Okay, and then these are the common treatments you'll encounter. It's a lot, but I'm not going to go into detail, but you'll learn a lot about which medicine to use. There's an interesting medication I learned when I was in vascular, so that's called iloprost. It's basically a medication that opens up your vessels, so they can help with they will help reperfuse so distal places where patients have peripheral arterial disease. So learn about iloprost. It's interesting. And then you'll see larvae therapy as well. So there's literally like it's a new thing. There's maggots in the bag. So you put that on wounds and they'll sort of eat all the disgusting wounds and they'll help in wound treatment. So especially for diabetic foot infections or poor wound healing or amputation wounds and then you'll see a lot of amputations. And then you also have like palliative discussions with families. So these ones you usually don't go alone. You usually go with a registrar or a more senior to talk about this stuff. But you learn a lot. So it's really interesting. So next time you can do it on your own. So you'll verify deaths, certify deaths as well. You learn how to prescribe syringe drivers for, symptom control at the end of life. It's good exposure. And then for holding the bleep, we don't usually hold the literal bleep, but we do hold the hospital 24 phone. So you'll just have to learn which patients you need to prioritize. So you'll get a lot of jobs. So the immediate, this is a traffic light method, I think. It's red, yellow, green. So red, emergency ones, like chest pains, patients with sepsis. There was a patient previously who had patient has a triple A. And then suddenly she was stable. And then when I was working that night, she had like some abdominal pain radiating to the back. And I'm like, this is suspicious. So I literally just called I assessed the patient, do what I have to do. And then just called the registrar and they came straight away and we had to push the patient down to CT. But yeah, just make sure you know which patients to prioritize. And then there's a lot of things that you can learn in the guidelines. So this is an example. So this is the intranet. You can see guidelines on COHA, and whenever you need to prescribe antibiotics, you don't know the dose, you don't know the indication, you don't know which antibiotics to prescribe for a patient with diabetic foot, for example. Just go to the antibiotics guide and they'll bring you where you need to be. And then so like I mentioned, important iloprost use, learn how to manage hyperkalemia, DKA, sepsis, and a useful app I had, I still have, which is Accurex. You can there's like numbers and extensions of literally everyone. If you need to call an anesthetist, the numbers there, urology, any registrars, bleep numbers. There's a lot of numbers that are really useful as an F1. And then these are just guidelines or things that you can sort of learn or be familiar with before you start the rotation. Because if this is your first rotation, then it's nice because you have time to like look things up and learn. But yeah, you'll get the slides so you can just see them all. So yeah, for portfolio building, vascular surgery offers a lot of opportunities. You can do case-based discussions, mini-CACs, you can discuss patients, about pain management, like Warfarin treatment, heparin treatment. You'll do a lot of procedures. You can also teach. So if you do want to sort of like build your portfolio, you want to teach about, let's say, chronic limb ischemia, just tell the team, and I'm sure they'll be like, okay, we can arrange a time and slot for you to teach. And then just ask the consultants if there's any audits you can join in. It's really good to have one when you start in F1. So because in F2 you'll be a bit more busier, so you won't have more time to do all this stuff. And then be very proactive. Ask a lot. Go down to theatres. Yeah. And then just one note, you can actually get like free shoes, like free Crocs in theatres. Just go down to theatre in Seafloor and just ask where you can get them, where you can get like theatre shoes. They'll bring you to the store and you just tell your size and they'll give one to you for free. And then just make sure make sure you just hydrate yourself. You won't have a lot of time to like drink, to eat. So make sure you find time to go for your break. And then, just make sure you introduce yourself to everyone when you come in. Anybody new, introduce yourself. Be very proactive, stay curious. Just keep learning. The registrars are very keen to teach. That's it. I'm sorry this is fast one because I'm not gonna like teach anything specific because there's so much to teach. You learn once you go into the rotation.
And if people have any specific questions, feel free to ask them. I'm sure Jazz will try her best to answer. And as we said, please fill out the feedback form and we'll send out slides to people who do it. And if people have any questions about not necessarily vascular surgery, but life as an F1, feel free to ask away. Any tips for night shifts?
Because we don't do night shifts in vascular. You only have
so in QMC they don't do night shifts. In some other hospitals they do.
Oh really?
Yeah.
So
okay, so you've been on other night shifts.
Yeah, night
other rotations.
I actually love my night shifts because it's much more quiet, so you don't have to like rush to do things. But whenever you have sick patients, then it's nice because you can just bring the med-reg. They'll be down there. Just ask anything. I love to ask stuff if you can't tell already. I just ask a lot of things, and then I just do them. Just know who to escalate to, I would say. Yeah, as an F1, especially on nights. I haven't had some like really, really bad emergencies yet. But my friend who held the bleep for like few nights, a night shift, it was so busy. I think they got like 5 medical calls at night, and it's just like one patient was like end of life, and then another is like just hypoglycemia. One had a fall and then collapsed. And then it's just you learn so much. But, you'll never be alone. And as an F1, it's a great opportunity to like hold the crash bleep because you're not the main person people go to ask for things, you just do stuff. But yeah. Anyone has any questions?
We said thank you for the tips on the night shift.
Oh, thank you. I mean, you're welcome. If you do have any questions, even about like MRCS, I did it after my med school. So if you think you can study and just do it not before you start because you're about to start. But yeah, just do it. Don't think too much. just study and then do it.
So what I'll do, guys, is I'll share in the chat as well just the other upcoming sessions we've got, because I'm aware you will have other F1 postings. So if any of those are covered here, we've got these events coming up, so we'd love to see you there. It's got another link to the feedback just in case. But then I will pause the recording. Thank you very much.
Cool. If anybody needs anything, I have my